Hi. Today I want to talk about what it means to be a good patient, how you can be perhaps a better patient, and that means then that we can be better therapists. So the first thing that I think is important as a new patient to a therapist is to give a complete history. What I have found when I have asked many of my patients about old injuries and so forth that they've had prior to whatever event they're seeing me for, many people claim that they have no older injuries to speak of. And then invariably, as I work with them, we discover lots of old injuries that have likely created the environment for these new injuries to occur. And their typical response is, oh, that was a long time ago. I didn't think that had anything to do with why I'm having pain now. And invariably, if you have chronic pain, it's because of some older problems that you've had. So telling your therapist the complete history of your injuries will be very helpful in expediting their understanding of why you're having pain. I remember one man specifically came to me for back pain. He was a lineman for the Oklahoma Sooners many years ago. And he said, I have no previous injuries. And I did a double take. I said, you're telling me that you were a lineman for the Oklahoma Sooners and you had no previous history of injuries at all? Nope. And then his wife gave him a little elbow and she said, well, tell him about your surgeries. I said, oh, you've had surgeries? He said, yeah. I said, well, those count as injuries because you had a surgery for an injury. And he says, oh, well, I thought it's a surgery. It doesn't count as an injury. And so then we had a whole laundry list of, once those floodgates opened, we had a whole laundry list of injuries that I understood were feeding his current back pain. So I guess to reinforce this first point, please give a complete history, regardless of whether your therapist asks for your complete history or whether you believe your older history of injuries has anything to do with your current pain. Give them a complete history because in that initial session or two, you guys are learning a lot about each other. And if you give them everything you can possibly give them in that first session, they have a greater idea of the history that you've been dealing with up until this point. I've had a lot of people who have typed out their history and then given me a sheet of paper, which has been very helpful because that allows me I can scan it into their record or I can highlight areas that I think are important and follow up with questions about it. So if you have a longer history, please feel free to type it up, bring it to your therapist. Okay, I'd like to just take a moment here to please ask you to like, subscribe, and share this video if you find it helpful. Thanks. Okay, so what's the next thing that you can do as a patient to help your therapist help you? In other words, to be a good patient. And that is to ask questions. And this was another thing that came up in my conversation with this one woman, was that she didn't feel that she should be asking questions about her care or her problem with a therapist because that would annoy them. Now, I get it. A lot of therapists don't want you to question their authority in helping you, which is unfortunate. There's a lot of ego in medicine, and that's unfortunate because there's a lot of learning that is missed because of that attitude. But I can tell you, as a therapist who's been doing this for almost 30 years, when patients ask me questions and challenge what I'm asking them or telling them and so forth, it helps me fine-tune my diagnosis because sometimes they'll think of things that I had forgotten or hadn't considered in regards to the diagnosis that I think is happening here. So please ask questions, regardless of whether you think your therapist wants you to or not. Ask the questions because, look, this is your body and your pain, and you're taking time out of your day and spending all this money on co-pays and doctors and therapists and so forth. You are paying for the right to ask questions. So please ask questions. It can only help. And if your therapist doesn't like you asking questions, then maybe it's time to find another therapist. The last point I want to talk about is when a therapist prescribes exercises to solve pain or fix a problem, you need to communicate whether those exercises are increasing or decreasing your pain. I have found, and again with this one woman, that the therapist that she was working with gave her exercises that increased her pain. And what she thought was that she just had to suck it up and do the exercises because the therapist knows best. Well, no, they don't know best because they can't be inside of your body and mind. So they don't know how you're reacting to the exercises that they're giving you if you're not telling them what your reactions are. So they will modify the plan based on your responses. So there's no way that I could ever work with a patient and expect myself to know everything that that patient needs down to the, down to the minutia of the problem. I need that give and take with the patient. I need them to give me feedback to tell me, oh man, that really helped me, or oh man, I was dying after that exercises. Well, all of that, and or if there's no change at all in your pain. So that information is critical to helping the therapist fine-tune your program of what they decide to focus on and how they decide to focus on it. So please communicate that. She thought that, oh, I've just got to be tough and suck it up. No, that is not the right attitude. When you're trying to solve a chronic problem, the purpose of the therapist is to help you reduce your pain. How does increasing pain, especially the pain that you're coming and complaining about, how does increasing that pain work towards the goal of decreasing your pain ultimately? I'm not a big believer in no pain, no gain, especially with chronic pain. I'm a believer in no pain, no pain. So everything that I do must result in decreased pain in some degree. Now, a helpful thing that will help that is that, for instance, let's say that your therapist has given you a clamshell exercise where you're lying on your side and your knees are bent and you're lifting, the top leg up, the top knee up and down like that. And after 10 repetitions, you start to feel the sciatic pain that you experienced and that you're trying to solve. Well, counting those repetitions and telling the therapist, look, after 10 repetitions, my sciatic pain increased, and then when I stopped, it went away, or when I stopped, it didn't go away. Those kind of details are really helpful. And then that's only one data point though. So typically I like to have 3 data points for any exercise, whether it's good or bad, knowing whether it's good or bad for someone. So in that case, let's say you did 10, let's say the first day they gave you something like clamshells and you did 10 repetitions and your sciatic pain was triggered, all right? And then you did it the next day and you did 15 repetitions and then your sciatic pain was triggered. And then the third day you did 20 repetitions and your sciatic pain was triggered. Well, what I have learned is that a patient will come back to me and say, oh, those exercises trigger my pain. And what they're not paying attention to is that, yes, but you're improving your ability to do the exercise before pain begins. And that is a critical piece of information. It means that we're on the right information, that you're building your tolerance for more activity, even though it's triggering your pain still triggering your pain, it's triggering it at a later point. And so another piece of information that I often hear from patients is, I did your exercises, I still have pain. Well, that doesn't really give me any information, because really what I want to know is, have you been able to increase the exercises before having pain? Does your pain increase because of any particular exercise I've given you? Are you able, for instance, if your sciatic pain was triggered after walking 3 blocks when you first came to see me, is it now triggered after walking 4 blocks? Is it now triggered after walking 8 blocks? All of that shows signs of improvement. Or is it going the other way? Now I have sciatic pain after walking just 1 block when before it took 3. That's equally important to know. So all of these can be collectively considered as communication with your therapist. Offer all of this type of information and be as detailed as possible in letting them know exactly which exercises are causing pain after how many repetitions. So this might require you to write down some notes about things, especially if you're seeing a therapist maybe once or twice a week. You'll need to keep notes as to how you're doing. And those notes will be invaluable to your therapist for fine-tuning and more quickly getting to the root of your problem. I hope that helps you become a good patient. And if you can become a good patient, then we can become better therapists too. So thanks for watching.